Hey guys, I'm going to answer a question that a lot of men have been asking me about ultrasound-guided trigger point and nerve block injections. Do they work? Should I do them? Etc. If you didn't know, I'm Michael Hodge. I'm the co-creator of Overcome Pelvic and Urinary Issues, which is a fully guided program that you can do at home to help you to address the root cause of pelvic floor and urinary issues, and you also get coaching support along the way. But this question that has been asked to me is regarding ultrasound-guided nerve block injections and trigger point injections. There are other forms of injections, steroid injections, and other things that maybe you've experienced or you've researched in the past, but I'm referencing this particular treatment that's becoming more popularized. In a nutshell, what's taking place is you have a practitioner using an ultrasound device to actually image and find trigger point knots, those muscle spasms that are holding really, really tight, that hypertonicity in the muscle, that tension is creating pain and dysfunction. So what's happening is it's helping them find it more easily and then actually inject directly into that spasm some sort of medication to help create a relaxation effect. Lidocaine or whatever else could be used in this case, and that's going to then allow for more blood flow and oxygenation and ultimately the relief of pain. And regarding the nerve block, it's similar, doing an injection close to a nerve into the muscle group right around it so that there's some space that's created around the nerve to create, again, more movement around that part of your body. So in theory, and of course in practice really, it typically does give you relief. It gives you some short-term relief. And if it gives you short-term relief and then it goes away completely and you no longer have any flare-ups, that's absolutely amazing. But in many cases, I have a lot of men who come to me who initially start the Overcome program. They're like, I did this therapy, I've done a lot of other things. Whenever I did it, I felt better for a while. I felt better for a few weeks, maybe even a couple of months in some cases. And it is a therapeutic approach, right? Can it help you? Is it something you should do? Absolutely, it's something you could do. I say therapeutic calming practices are very useful, as long as you know that there could very well be something beneath the surface. It's important that you ask the deeper questions. So some people just ask, I have pain. And why do I have pain? Oh, it's because I have tension. How do I get rid of the tension? You can get rid of the tension by stretching. You could take some deep diaphragmatic breaths. Maybe get a really good body work massage session. Maybe get injections like this. They absolutely can help you to break up that tension. The more important question to ask is what's creating the tension? Because if you don't ask that question, you absolutely can break it up therapeutically. You can do some mechanical or chemical or other sort of interventions. But if you don't ask the deeper question, it'll just come back. So what I'm saying here is that by all means, if you're in extreme pain, crazy tightness, you feel like this is a good option for you right now, by all means, you can do it, and it can help therapeutically. Because if you're in extreme pain, and people ask me the question about medication, it's like, should I take medication? Should I take pain relievers, etc.? Or should I do everything natural and organic? And is that a bad idea or not? If you need something to help you to go from like a level 8 of pain to 5 or 4 or 3, so that you can even sit down and journal, so you can even clear your mind and open your heart, so that you can discover the repressed emotions, so that you can start changing behaviors, recognizing stress-inducing personality tendencies, doing the work, understanding the deeper information of why this is taking place. By all means, if that will help you, then do it. And if you do it and you're completely cured, that's awesome. But know, by the way, how mind-body syndrome works. You might think, oh my gosh, I'm cured. I no longer have pelvic floor tension. But you start having back pain 6 months later. Or you start to get headaches every day, or you have IBS, or some other psychophysiologic disorder. So if you're not aware of that, and you're just looking at it from an allopathic perspective, I have an issue in my pelvic floor, let me fix the pelvic floor. Oh, now I have an issue in the stomach, let me fix the stomach. Now my back, let me fix the back. Actually, the whole mind-body organism is one thing. You are one. So I just encourage you to do the deeper work, to have a higher level of awareness and consciousness in your perspective of treatments like this, so that yes, it can therapeutically be assistive, but is it curative? My goal is to help people have a curative approach so that they can address what's really at the root of not only their pelvic floor dysfunction, but probably also anxiety or other mind-body disorders that they're currently experiencing or they have in the past. So if you haven't joined the Full Overcome program, I'd love to have you in there. I just wanted to share some words from Mike, who did the program. Hey Michael, with your help, I was able to 95% recover from CPPS after 2.5 years of pain. It took me about 3 weeks. I had terrible testicle, perineal, and burning pain when I was peeing. The testicle and perineal pain is gone. Thank you, Mike, for sharing that. And I'd love to have you work with us if you're called to it so that you can overcome your pelvic pain and urinary issues. I'll see you in the next video.